Welcome back. When was the last time you had your eyes checked? You may not know this, but during a routine eye exam, doctors are also looking for other potential health problems. Here to explain the real reasons for regular eye checkups, Dr. Brent Reed of Griffin and Reed Eyecare. Nice to have you back, Dr. Reed.
Thanks, Walt.
So what are some of the common things that you're looking for besides just eye trouble?
Well, what most people don't realize is just about every disease process that affects the human body has an eye manifestation.
Mm-hmm.
Some of the things we look for commonly are signs of hypertension, diabetes, other common health problems. You can sometimes tell something about high cholesterol, and common things that might cause problems that we can pick up on earlier than we might otherwise find them.
Most of us with a regular doctor, we feel badly, we then schedule an appointment. That doesn't necessarily work with the eye exam.
Unfortunately, it doesn't, because a lot of the eye diseases that affect people's vision and actually take their vision away very slowly and irreplaceably have no symptoms whatsoever. That's the problem with a lot of the eye diseases, glaucoma being one, but there are many others as well.
We have some pictures up here that we're going to put up on the screen. Maybe you could tell us what we're seeing here. I can't pronounce that word.
It's called a PINGUECULAE.
Of course,
yeah, of course it is. Somebody was on drugs named that, obviously. But what that is a small bump on the front of the eye that's caused by overexposure to UV sunlight, UV exposure, UV sunlight.
I think we have some other pictures too that we're going to put up as we go along.
This is an increased manifestation of the same thing that actually starts to get onto the cornea and affects vision. These sometimes require surgical removal.
Okay. And the next one?
And this is a melanoma. You were talking earlier in the newscast about melanomas. They actually occur in the back of the eye too, and normal moles occur in the back of the eye about in about every 13 people that walk through my front door. So they need to be watched as well. Again, this is a sign of diabetes with some leaking blood vessels that we'll sometimes see that needs laser attention in order to save the sight of this patient.
Okay.
And in glaucoma, you see a hollowing of the optic nerve. That white spot in the center of that optic nerve indicates it's damaged from high pressure in the eye, which this patient was not aware.
I have one more here in my slideshow here.
This is a peripheral retinal degeneration that can sometimes lead to a retinal detachment called lattice degeneration. And again, the patient would be unaware that was there unless we actually saw that on a routine eye examination. Now,
most people should get a physical exam once a year. What about with eyes?
With eyes, it varies depending upon the age of the patient. But I think that I often see people come in their mid-40s needing reading glasses, having their first eye exam, and that's not a good idea. Probably you should have an eye exam by the time you start junior high school, if nothing else is wrong. And then about every 3 to 5 years if you have no problems until you get into your 40s, and then about every 2 to 3 years.
Now, some people who have certain problems like diabetes, should they be checked more for eye problems?
They should. They should have at least an annual exam and sometimes more often. Those with a family history for glaucoma should also be seen at least yearly, because there's a 35% chance they'll develop glaucoma as well.
It's amazing how many people don't get their eyes checked, or they do it and then they have the same prescription for 10 years. And until something happens, they go, you know, I should go back in. I just ran the car into a tree and didn't see the tree. You know, they wait for an event like that.
They tend to ignore it until it's a crisis, but the problem with visual loss is it's not recoverable. So you can heal, you can get back to a state of functionality sometimes, but what you've lost, you don't get back.
Back with a final check of our top stories, weather, and Wall Street right after this.